Brown, and this is LA Currents. The coronavirus, COVID-19, brought with it a trifecta of bad news for health, for finances, and now, as it turns out, for mental health as well. But we have some wonderful guests here in the studio that will help us manage this particular asset of COVID-19. I'm delighted to welcome Joanne O'Brien and Dr. Kokinda from LA City Medical Services. Thank you both for being here.
Thank you for having us.
Thank you. I actually want to start a little bit on the medical side as far as COVID is concerned. When we first had an opportunity to speak at the beginning of this pandemic, you were expressing that this is a brand new virus. It doesn't have that much information. We don't know what it's going to do, and that seems to be playing out. There are new things coming up about the virus constantly, including symptoms.
Yes, the symptoms, in fact, today the CDC said there's 6 classic symptoms that they're seeing sort of across the board: fever, chills, sore throat, the achiness, and the loss of sense and smell. You know, to smelling something, tasting something, those senses kind of go away. And with a lot of people, that's the very first thing that happens. So that's very new.
Yeah, well, so then things are changing on a daily basis, which obviously will continue the more we learn about the virus. But there is some good news coming down the pike as to how the body can manage it and how we can manage it.
Well, we're learning. Science is sort of catching up because it is a new virus. It's a novel coronavirus. The word novel means new. So I think as we learn things, and I think that is a frustration for a lot of people, because when science says, oh, this is what's next, and then it changes the next day, is we're learning. And as we learn, the science may change, CDC may have new guidelines. So I think we all need to be patient. But we are seeing how the body's reacting, and when we learn that, we can come up with better treatment methodologies. For example, placing a patient on their abdomen to help them breathe better, which is sort of new. That's new in medicine. We never did that before when someone has shortness of breath. So that's one of the new things we've learned as we take care of patients.
Well, and patience has been the cornerstone of all of these hopeful outcomes. And patience also included us staying safer at home and quarantining. And with that has obviously demonstrated an enormously new arena in which we have to sort of think about, and those are the mental health issues. And the mental health issues are literally directly tied to how people are handling this pandemic. But Dr. Kokinda, as a species, how are we at adapting to such stressful and dramatic changes in our lives?
You know, humans are actually quite resilient and quite adaptable, which is the good news. That being said, in the beginning, it always feels rough. But think back through history, there's been a lot of challenges that human society have been able to evolve and adapt with the circumstances.
Well, and as long as this has been going on, I mean, I think people are actually kind of learning a little bit about themselves, and everybody's experience has been totally different. Mm-hmm. So being quarantined at home has caused some issues for people. And what are some of the things that you have heard of or seen when people have been living in this new reality?
You know, quite a few things have come up. Some surprisingly good benefits. People are reconnecting in ways that they hadn't been able to before because of the time together. But also, conflictual relationships have had some fuel to the fire with being home so much with the stress, especially now with increased financial stresses and other things like homeschooling children at home. People aren't getting the break they used to by being able to go out for a meal, the kids go to school, those types of things.
What are some of the tools you can use if you find that you're starting to, get a little bit anxious? Because, it is taking time. And the more we learn, the better it's going to be, and the more freedoms and liberties are going to be provided back to us. But it's not going to be the same. So obviously, we're all going to need to adapt, and we're all going to need to, sort of monitor ourselves and those around us, and, use some very strong tools. And you're the expert in tools.
Well, luckily, there's a big toolbox for this. Lots of things that psychologists are recommending now is, first of all, keep your routine to some degree. It's going to look very different. That's something we all have to accept, but try to keep a routine. If you're working from home, try to get out of your PJs, get into some sort of work frame of mind.
And we don't mean your daytime PJs from
right.
your nighttime. We actually mean get dressed.
At least to some degree, yes. Switch it up, get into a different frame of mind. If the kids are home, give them some structure. Right now the goal is not to be a perfect parent. That's never the goal because that's impossible, but particularly right now, make sure they're getting some stuff done, but also a little extra screen time or that type of thing. It's okay. So keep some routine if you can. Be mindful, stay present in the moment. Don't let your thoughts get too far ahead of you. It's good to make plans, think about your future and potential challenges. Be prepared for that, but once you have an idea of what you may do to manage situations, distract yourself, relax, watch something funny, play a game with your kids, do a walk around the block if it's safe, whatever you need to do to let your thoughts regroup and not go to that worrying state.
I love that whole idea of not being perfect. I think all of us are, obviously not necessarily understanding what's going on, or if we do understand what's going on, not understanding where it's going to go, and then feeling as if we have to be brave and bold and strong and a teacher and a mom and a worker, and if you're working remainder, but you can give yourself a little bit of a permission slip during this time to not be that perfect person.
Definitely. You can always give yourself that permission slip within reason, but now especially, it's not about winning the pandemic. It's about getting through the pandemic, keeping everyone safe, healthy, balanced. That's what you're looking to do.
Yeah, and talking about going out for a walk, obviously masks are now part of our existence. Social distancing and masks. So the whole idea of masks came a little bit late versus the very beginning of what we began to learn about COVID-19. So why masks now? What is it about masks?
The virus, as we've learned, is spread through droplets. It's an aerosol. So those, when you're normally speaking, those will just come out, just small droplets. You can't see them. But when you're breathing, when you're talking, especially if you sneeze or you're coughing. So that's why they recommend, to help prevent the spread, some sort of face covering, and it doesn't need to be the fancy N95s the medical staff wears or our firefighters, because they're in close proximity to a patient. They're really close, they're caring for that person, and that's why that group of people need to wear that mask. But when you're out and about, the cloth covering just simply keeps that spray in instead of you have a barrier. So when you're talking, it's not spreading anything. So it's really making the world a lot safer. And so you have the opportunity, if you stay in and you wear a face covering, to save your own life, to save someone else's life. So it's really important.
But what about when you're outside? I mean, if you are taking that walk that Dr. Kokinda, suggests with your children, do you need it when you're outside, when you're, a reasonable distance from whomever is walking the other way?
I think it's a personal decision.
Okay.
If there's no one around, you're not really at risk. But a lot of people are more comfortable wearing them. It's best to wear them. It's very simple. You can just take a scarf, put it over, and then you've made the world safer. So I absolutely, when I go out walking, I wear one.
Well, and then you also see people, because I wonder, and I know we've had conversations, where, you see people wearing them in a car, and you're thinking, why? Why do they have that on in their car, and they're by themselves in their car?
And they may have had someone in their car, so that they're protecting themselves or that person. That person might be a critical worker in their house that is out exposed, but that person doesn't have a car, doesn't want to be on public transportation. So there might be a story there you don't know about, or it's just that person's comfort level, which is okay. However, is going to help that person get through all of these changes in the pandemic.
That kind of goes back to the emotional issue. What is going to make people comfortable? And that's okay, to sort of whatever's going to make you feel safe and comfortable. And we shouldn't be judging other people's decisions.
Right. There's always information we don't know about someone else's situation, which nowadays gets confused easily because we look at things like social media and we see everyone's photos of their family looking perfect and happy, but the reality is no one's life is perfect, and there's always stuff beneath the surface that we're not aware of. So we want to stay away from judging others in this time and hope that they do the same for us.
And that little bit of kindness can go a long way, especially when you're talking about, I know one of the fragile groups, obviously, are seniors, and this has got to be really tough for them, because not only is there a health crisis, but there's also that sense of isolation, because now they can't have the visits that they would have from family members, or have the experience of socializing in a restaurant setting or something like that. So what are some of the things that we can do to help those fragile communities such as seniors?
Definitely reach out. Make sure, just because you're busy trying to manage, kids and all these sudden changes, that seniors don't fall out of your thinking. Give them the call. Try to, if you can, give them a FaceTime chat or video chat. Let them see your face. If you can safely drop off a care package or something, that's something people have been doing also. And keep in mind, seniors are a population that's lived through a lot of different adverse things in the past, so they probably have a lot to offer you as well if you have some conversations about how to be resilient and get through tough times.
That's actually, I hadn't thought about that, because, so many of our parents and our grandparents have lived through nothing like this, however, but they have lived through really tough times. So they could be a really good source of venting and advice with all of us trying to manage this.
Definitely.
Yeah. Well, I know not only can we, enjoy the company of our children and the company of our virtual friends and everything like that, but this seems to be a really good time for people to pick up new pastimes and new skills. I know that that's one of the things that a lot of people have decided to do in order to make this time valuable personally. You made banana bread.
I did. I'm on the list of the million other people apparently who've been making banana bread lately. But that goes back to the coping skills. You want to keep yourself busy. It distracts from the negative thinking, the worry, the stuff that's not productive. So people are cooking, people are doing other at-home projects, and that's great, because these are things where you can start a project, have some control over it, learn something new, and complete it, and feel that you are still progressing in this crazy time we're all enduring.
As long as those habits aren't bad habits, because I know, you're allowed to have some banana bread, but you can't have a daily diet of banana bread or pizza or all those other comfort foods, in my world, macaroni and cheese, because obviously the health the component of this is incredibly important.
Right, and the stress, sometimes people are giving themselves permission to start happy hour because they're at home at noon in the video conference, and if you take your beer bottle and it goes under there, you might want to think about that.
Right.
What door you're opening, and just because you're home or you're stressed, that you need to do positive things, because this is the time where you need to work on your immune system. You need to take extra good care of yourself with eating healthy foods, drinking a lot of water, exercising, and getting enough rest.
The immune system seems to be a critical arena
Absolutely.
in regards to being able to battle this, whether you are in a fragile community or not. I mean, they're talking about the different potential, that's the word I'm looking for, to help in making your body fight this off, is boosting your immune system.
Right. Correct. So, and especially if you're someone who has comorbidities or other diseases that put you at risk, hypertension, diabetes, asthma, you need to really take extra good care of yourself, because to boost up your immune system, and we know the number one thing to boost your immune system is to get enough sleep.
Oh, well, and that's one of the things, though, that, one of the secrets or the keys to this you might not recognize is people are having a hard time sleeping. People are not, their sleep patterns are way off. And you would think being home, that would be something that would be easy to do. But for what is the body doing that's not letting you sleep?
Well, there's a few things. One, like I mentioned, the routine is completely thrown out the window for a lot of people. And with that, a little bit of chaos ensues. So part of that routine, it's not just changing out of your night PJs for your day PJs, but it's also trying to keep a regular bedtime. But also, people are up when you're stressed, sleep suffers. You might feel like you don't have energy, and you might feel down during the day, but it's still a struggle to sleep at night. Sometimes your mind keeps going, and that's part of the problem, is shutting that off. Other times it's just restlessness at night. So that's all been on the rise lately.
And dreaming about Zoom calls. I don't know if I'm the only one. I'm actually having Zoom calls in my dream. I mean, it's a very odd time. So obviously little things happen because we're all experiencing this, but what are some of the signals that we should be concerned, for someone who normally doesn't think of themselves as having any kind of real mental health issues? What are the triggers or what are the signs that if you're having at home, you should realize, wait, maybe I need to take this a step further and get some assistance?
It's the things we mentioned, the trouble sleeping, irritability, detachment, low mood, or the inability to turn off those excessive worries. It's not a little bit of that. It's, okay, this has gone on for a few days in a row. It's continuing to go on. Usually when it reaches about a week of these concerns, it's definitely time to reach out, but everyone right now is being impacted. So it's good to be proactive and get some support or resources as soon as you notice you're not able to use your usual coping tools and get yourself out of the rut that you're feeling.
And I would imagine if that's happening in your home and it's not just you, because you did mention, aggression and things like that, there are resources in LA City for people who have found themselves in an untenable situation because of those that they are quarantined with. I mean, I know we had mentioned something about spousal abuse and terrible things like that. So, but there are places for people to go. You're not trapped.
Right. There are safe shelters. I know the Los Angeles Police Department is ready to respond. They want to know about this. There's safe shelters. There are numbers available. So I think Chief Moore's message is you don't have to stay there. You're not alone, and there's help.
Well, that's really nice to know, because I think that there's also that issue of we don't have any choices right now. We don't have any power. We don't have any ability to make any decisions. But then there's also this backlash that's happening. So why is this backlash happening? Where is this sense of this is not something we should be listening to? Why is that happen? What is the human psyche that says, no, I don't want to stay in anymore. I'm going to do what I want to do, darn it.
Well, we all have a bit of that in us. Joanne and I have mentioned that it's people wanting to take control back because everything feels so out of control, and it also goes down to just how some people cope. Could be a bit of denial, could be a bit of other ways where they just want to return to normal and put blinders on and get back sooner than is recommended.
They talk about the stages of grief. Are there actual stages that we can sort of take a look at and see that these, because I know that you had worked in an arena in which people were incarcerated, prior to your work with the city. So are there stages that people go through that you can almost oddly predict given what's going on now?
Definitely. The stages of grief, it's not just the loss of a person, which unfortunately some people are experiencing now, but the loss of other things. Everyone's life, no matter who you are, has been turned upside down, and it's been that way for long enough now, where the initial shock of the situation is wearing off and people are going through these stages. Adults, children. I was just reading some literature on teenagers having a very hard time right now because their social life has been completely changed and limited, and they struggle with coping with those emotions. But if you look at the stages of grief, you can apply a lot of that to the situation.
That has to be so tough, especially, say, for the class of 2020, and teenagers in general live in packs. They're breaking away from their parental ties in order to be independent, and so they live with each other. This has got to be really tough. So I'd imagine parents of teenagers have to be very sensitive to what's happening with their children.
Yes, exactly. I can only, it's been a while now, but I can think back to being a teen, and
Sure.
This would have been my worst nightmare, being trapped at home, even though now they can text and call. A lot of teenagers are saying it's harder to see my friends on the Zoom screen because that makes me miss them even more. So parents are having a tough time because they feel for their kids. It's raising those tensions in the household. And the best advice for parents with that is just know your kids are going through a lot too. Parents are stressed, kids are stressed. Give them the room to have those emotions and try your best to help them express them in a way that's as healthy as possible.
And what about the little guys? the little guys. I mean, you have a little guy. What about the little guys? I mean, there's the plus of having, their parents around a lot, which is great.
Yes.
And there's the minus of this is what's going on. Everything is not the way I'm used to having it be, because obviously children love, routine and knowing where the line in the sand is. So what about the little guys?
Yeah, it's a struggle for everyone. With the younger children, one of the best things is know their developmental level and explain to them what you can. You want to be honest, give them some information so they see why everything's changed. Know that they're also going to be upset about the change in the routine. So try your best as parents to be patient with them. Be creative. Right now on the internet, there's a lot of great ideas about how to entertain kids and keep parents sane. It's one of the best times and the best topics for the internet, because you see so many creative parenting ideas to try to keep the households somewhat calm.
And we're going to be going through another transition as things begin to loosen up. Obviously, it seems that Los Angeles has, obviously hit some hard times, but we seem to be a lot more controlled, obviously, than a very limited space like New York was, which was catastrophic in so many ways. So now we're going to get back into the workplace, maybe slowly, and that obviously means there have to be some very conscientious choices made there.
I think the workplace is going to look very similar to what it looks like right now. I think until we find a vaccine, until we have a way to really combat this virus, people are ready, and when it's safe, people will be returning to the work. But how we work might be different. For example, you have a construction worker who maybe would share tools. That's not a good idea anymore. You have to bring your own tools. And if you are going to share that tool, you have to sanitize, you have to clean it before your coworker uses it. Things like that. When they're up in a building something, making something, they'll have to be apart 6 feet, wearing face coverings. So I think our world will look different. We'll probably have a lot more Zoom meetings, so you might be dreaming about them more. I don't know when we'll be ready to have 20, 30 people in a room for a meeting. So I think our world, we can go back to work, but how we do that is going to look different for a while.
And how do we prep for that psychologically? Because there are going to be people who are going to jump right back in because they're social creatures and they miss humanity. There are going to be other people who are going to be terrified that they are going to get sick or bring that sickness home. Or, I mean, the scope and scale is going to vary. So what should we internally be doing to sort of work our way back into, because we've all changed, whether I scrub things down forever is a big question mark in my life. What's going to happen? How do we figure that part out? How do we be sensitive to what's happening internally and those around us?
I think one thing goes back to be careful judging others and their situations you may not know, or internal processes someone else might be going through you're not aware of. But also be mindful that you're going to have to stay in the moment. We want to practice mindfulness. Don't get too far ahead, because we don't really know what's going to happen. It's a lot of unknowns, and that's hard to cope with for any of us. So stay present in the moment, do your best in that moment, and practice acceptance. Yes, it's different, but we don't want our thoughts to go to everything that's bad, we think is bad about the new different. There's pluses too. If people are more attentive with their hand washing and more mindful of those things, that's going to help cold and flu season, which is something that we've all struggled with in the past. So try to find stuff on the positive side for the changes as well.
Like the moon. I don't know if anybody's seen the moon this week, because the air is so clear. It's absolutely beautiful, and you can see Venus. So the air is cleaner. There are some good things. I see more families together outside walking, where you didn't see that before. So I think Dr. Kokinda raises a really good point, and laugh. Find things to laugh at. And enjoy the moment of being together with your family, because we're always so busy usually.
Right. Well, and your point of distraction, but also staying informed, because you've said some very important things, and we're sharing some very important information. But there is a fine line between understanding what you need to understand and having the information, and then being overwhelmed. I'm sure that there's also that pendulum that's been swinging back and forth. So how much should we be taking in this time? Because it's been all COVID all the time.
That's true, and it becomes overwhelming very easily. So first thing, you want to check your news sources, make sure that they're credible, because if you're getting information, you want to make sure it's correct. And then get your news, learn what you need to know. There's been so many updates, so obviously it's important to stay informed. Like, are we wearing masks? What do we need to do? Once you get that information, shut it off for the day, you know. Figure out your routine, but then put the news away. And same with social media. If it's adding to your day and helping you feel connected, great. But once you start to feel overwhelmed by it, or start to feel badly about your situation or something, put that away too. It's okay to shut off the phone for a bit. Even if you're working from home, you can take a break.
There have been some good things, as you said, you know, families getting together and people going on walks. So what's the best thing you've done during your quarantine, Joanne?
I rescued a cat that was going to have kittens, and she just had kittens.
So you have kittens?
I
you have
do.
baby kittens at home?
I do, and
Are they
so
all
much
yours now?
fun. I don't know, but
How many
but
she have?
she had 5. But it's helped all of us. It's kind of interesting how things walk into your life, and it's just a lot of fun. We're enjoying them.
It's funny that you should say that, because I just talked to a dear friend who she had her friend leave a dog at her home because she was going back to the UK to get something. Obviously did not make it back, and so now the dog is probably hers forever.
Right.
So animals are a great thing. What have
Yeah.
you done besides banana bread?
You know, it's hard to say besides banana bread. I've got this new recipe you wouldn't believe, but I've really just enjoyed the time with my daughter and cooking and getting back to the basics. Things were so busy before, we're all over the place, that now doing little projects at home, it feels good in a certain way.
Yeah, it's interesting how the priorities did bubble up.
Mm-hmm.
So you're right, there have been some very positive things about all of this. But we also have to be sensitive to, there are a lot of people who are coming out of this and it's not been positive.
Right.
You know,
Right.
people who have suffered with family illness and or death. I had a dear friend whose wife and daughter were both in the ICU, and it's been really poignant to hear his perspective.
Absolutely. I think everyone knows someone and has been touched.
Right.
Absolutely.
Right. So when all this is past and, you know, we look back, how has Los Angeles done? Have we done a good job? Have we done the best job we could, or did we learn a lot?
I think we are still learning. I'm completely impressed on how Los Angeles has handled it. I think everybody really worked together. Everybody did what they were supposed to do. And you can see it by the numbers.
Mm-hmm.
So if you just watch those, and if you're data driven, but it's been pretty impressive of how the whole community has come together and helped each other. I think that's what's been amazing.
And you've also spoken about how people's jobs have changed, but you've also seen how people have changed what they've done in the world of psychology.
Yes, there's been a lot of changes. First of all, more people are reaching out, which is great, because as we speak about, there are some unexpected good sides to what's going on. A lot of it has been very tough for all of us. We've all had struggles. And people are reaching out. There's telehealth now, which
Yeah.
is people can participate in therapy sessions from home very easily. That's been across the board very successful at this time. And there's even things like text therapy, where some groups are providing support through text messaging. You can sign up for that and get a mental health professional who will be there for you in that way.
Text messages.
Mm-hmm.
So a lot of big happy emojis.
Yes, that's and I'm sure some other good stuff.
Well, we've all become a lot more tech savvy, I think, in this whole experience. That's for sure. I think a lot of us have made that leap in terms of not being afraid, in order to be able to take a little bit of control in order to make it through all of this. But you both have done unbelievably heroic work, and thank you both for sharing all of this great information. And I certainly hope that when all of this is over, we will all be happy and healthy in more ways than one.
Absolutely. Yes.
Mm-hmm.
Right. Well, thanks again.
Thank you for
Thank
having
you
us.
for having us.
And that's a wrap.